All right, Dr. Ben Coughlin, facial plastic surgeon at Only Plastic Surgery. Jawline sculpting, contouring, defining, peaks and valleys for shadows and curves. Snatching goes by many names. What are we doing? Why are we doing it? And how do we do it? So check out this woman. And you know, a key thing here is why some of these products and some of these techniques that are out there don't work for you or other people. There's this classic population of patients that I see, they fail Kybella, they fail lipo. Why? Look, check out my girl here. You know, oftentimes what happens, it has to do with the hyoid bone to the chin tip. So if you don't have a lot of fat there, if you're relatively thin and you feel like you got a pouch, but it just, you know, you don't have a lot of body fat, you know, index, then it likely has to do something with the structure, whether it be the hyoid bone or the chin tip location. So we can pull that chin inferior and anterior, inferior meaning this direction, anterior being this direction. So I kind of do it on an angle like that. And that can really allow me to snap in the jawline. You know, Kybella, deoxycholic acid is the injectable that gets the fat. People are like, oh, that doesn't work. It works, you just gotta select the right patient. So if somebody selected that and you did 6 treatments and you don't think it worked, likely you weren't the best candidate, and that's where the error was. So something I do really well is to define, you know, do a facial analysis and really determine what can get you what you want. So I tell patients, you know, tell me what you want. Don't tell me the procedure you want, tell me the look you want. You know, show me what you want. Show me who you think's hot. Hot is hot. So when you show me that, I'll say, okay, for you, Kybella could work. If you have this little isolated submental fat pad that you can actually grab with your fingers, maybe Kybella is the option. For a lot of people, the jawline sculpting I do. So I do an extended neck and jawline sculpting. I like a way back to here, we get things to suck back. Do that in combination with some sort of tightening technique. We're gonna publish that right now. You can really, you separate the skin of the platysma, you separate the skin of the skin from the deeper tissues in the neck, and then you snap them in. Think saran wrap with a blow dryer. So that's another great option. That's extended neck and jawline sculpting. Chin implant, genioplasty, mandibular advancement. We got lots of things we can do. It's all about the jawline. At this point, 95% of my practice is the jawline, the lower third of the face. I still do blephs, I still do brow lifts to get things to snatch in, but you know, I'm really micro-focused on that area. And I also think that's how you can maximize results. That's really how you can maximize results and you can advance a field. When you get really good at one thing and you do it over and over and over, it's interesting because the case actually becomes more complicated. Which is, it doesn't make sense, right? You think the more you do it, the easier it should get. But the more you do it, the more you kind of find, oh, well, what if I do this? Oh, what if I tweak this? So that's something I've done really well, and that's how we've advanced the field. And it really is, I call it the peaks and valleys, you know, peak, a little bit of a valley, peak, a little bit of a valley under there. So you can make the peaks more peaked or the valleys more deep. And that's how you contour and sculpt somebody's face. So the volume redistribution, the way that putting volume here changes the volume there is really interesting. I've been studying scientifically volume redistribution of the face now for like 12 years. We published a few pretty good articles on it, showing that when I pull the chin forward, it actually reduces the volume in that location because it has to move it somewhere. If you put your 2 fingers right here and pull forward, that area will get more narrow. So it's just an interesting dynamic. The face is a 3-dimensional dynamic portion of the body. It has a lot of anatomical, you know, important factors that can change, you know, and there's also a lot of really important structures there. So again, another reason to go to somebody that over and over and over does it. I know where every nerve is, I know where every artery, vein, all of that in the face, muscles, bones, and all of it contributes to getting somebody sculpted and looking nice. So, you know, that's what I have to say about that. But the key is find someone you trust and be clear with your goals. And then that way you can develop a plan on how to best get you there. So we have a few before and afters. I'll flip them into the thing in the background here for me. And you can really see how things start to kind of snatch in. It's about pushing here, pulling here, and really getting the contour. And you know, we have fun while we're doing it. So results, safety, and enjoyment, those are my 3 pillars. Results, safety, and enjoyment. And I think if you can do it safely, if you can enjoy it and get the results you want, that's really the key. All right, Dr. Ben Coughlin, facial plastic surgeon at Only Plastic Surgery. You know, we're showing you how, what, why we do these types of things. We're having fun while we're doing it. Check us out. You know, if you have questions or specific things you want me to focus on, please let us know. Keep it real.